This now Republican representative from Tennessee, Congresswoman Marsha Blackburn. She's a member of the Energy and Commerce Committee, currently overseeing the 1,000-page health care bill. Congresswoman, thanks for being with us. You suggest the best thing to do with this bill is put it through a shredder. What would you replace it with?
I would come back and replace it with some of the good options that are out there. We've got the Shattuck bill, the RSC bill, the Ryan bill. There are plenty of ways that we can address the needed insurance market reforms. And Joe, as you know, previously the House has passed many of those. In 2006, bipartisan support, sent it to the Senate. Senate didn't get cloture. So I think we're at a point where we need to punch the reset button, declare a do-over, and take out a clean sheet of paper and go to it.
Would you support a plan that would not allow insurance companies to deny coverage for pre-existing conditions?
Yeah, I think that, and this is one of the things that we have in the Shattuck proposal, which is one of the alternatives that I do support and is linked on my website. But there has to be a risk pooling or a type way for those that have pre-existing and chronic conditions to get affordable private health insurance. And by the same token, there has to be a requirement that when someone has a policy in good standing and they do get sick and they do need to exercise the benefits of that policy, that the insurance company does not drop them. And so there are some market reforms that do need our attention. I think everybody agrees with that. They all agree cost is too high, that we need to look at some of the asset restrictions or the restrictions that are there for individuals being able to actually get to health care. We also need to look at portability, which with women, as I talk to women around the country, I think that is the number one issue that is of concern to them. And then liability. We definitely need to address liability.
Pat Buchanan, it seems to me if a bill does get passed, the one thing that both parties can agree on are insurance reforms, consumer protections. Do you agree?
I think so, and I think allowing more competition among insurance companies within states is something an awful lot of people would support. I agree with the Congresswoman. I think they really, and maybe Barack Obama and the Blue Dogs and the progressives are going to fight this out and come to a conclusion. But I think what would be best for the country, given the economic environment, the exploding deficits and things, would be to start over and get these reforms we can all agree on and get those done. And I don't know that, and I'd ask the Congresswoman, do you think they're going to get through a bill that has a government option in it?
Pat, I don't think that they will. There is, doing the town halls, I've done 11 town halls. I've also spoken to civic clubs, chambers of commerce. There is not the support for that. And, of course, in Tennessee, we had TennCare, which was the 94 test case for public option health care, or Hillary Care. And we've seen it go from a $2 billion to an $8 billion program. Our governor has worked diligently to get the costs down. Indeed, he was quoted in the New York Times as saying Obamacare would be the mother of all unfunded mandates. And so we know that public option in competition with private insurance drives the cost of health care up, it drives the cost of insurance up, and it makes it very difficult to have access to the type of health care that our constituents need. So we know what happens with this.
Congresswoman, let me ask you about some of the charges that have been going on out there. First of all, we'll start with the death penalty charge. I've been critical of attacks on both extremes. You don't see anything in this bill that would lead the federal government to unplugging grandma in her final years of life, do you?
What is in the bill is in Division B, Title II, Section 1233, is the information, the instruction, if you will, which is a mandate to change the Medicare and You health book to a guidebook to allow for end-of-life planning, and it's called advanced planning, that entire section. And what we have here is the fact that that door is opened. It is a requirement for our Medicare enrollees.
Well, it's counseling, right? It's not, but it's not a death penalty. It's counseling. Saying maybe you should get a living will.
Counseling.
How do you go from that? Not you, but how do certain leaders go from that to saying death panels will be impaneled and Granny will have the plug pulled.
Right.
How do you do
that? Well, what happens with this, I believe, and this is just my opinion, when you have that type mandate, and it is a shall, and that means you got to do it, that has to happen, and that instruction has to happen. And while living wills are something that we should have, my husband and I have a living will, but it should not be a mandate of the federal government on individuals who have prepaid their access to Medicare. This money has been coming out of their paycheck.
Right. But going back to the question, I've got to ask you again, though.
Have that counseling.
I've got to ask you again, though. Does that equal a death panel? I don't think it comes close. I think it's counseling. A death panel would be somebody saying, Joe, we're just not going to give you the operation you need. Goodbye. Because you drink too many lattes with whipped cream on it, you deserve to die. That's a death panel. But having a mandate even for counseling for end of life planning, that I just don't see how you get from there to a death panel. Are you saying it is the same as a death panel?
Joe, what you have happening, and there again, this is in my opinion, and from talking with our constituents and reading the bill, which I have done, when you have that mandate to put instruction for end-of-life planning in the Medicare and You handbook, right, and you are required to go and visit with the counselor, and then you leave that opening for what is going to actually happen through that counseling process, how decisions are going to be made, and you insert the uncertainty of that federal government into that situation with those individuals. And what most individuals will tell you they would rather do is say, oh, we need to make these plans. Now, I talked with someone yesterday that works with nursing homes and individuals that are going into those long-term care facilities, skilled nursing facilities, nursing homes, and they told me that in the education process, which is important, that's an important component, and in the education process that they go through, they find that 60% of our seniors make those necessary plans, but to have that heavy, long arm of the federal government reach into something that is a very, very personal decision is distasteful to me, and I think it is distasteful to our nation's seniors.
Congresswoman, can I ask you to clarify something?
Jonathan Capehart, Washington Post.
So is this rule mandating that seniors or just anyone, does it mandate that you have to go in for end-of-life counseling, or is it that if you go in for end-of-life counseling that those expenses would be reimbursed? And why shouldn't that happen?
It mandates a change in the Medicare and You handbook, and it mandates that you go in for this advanced planning or end-of-life counseling. And it is the fact that it is a mandate, it is placed on our seniors. Our seniors have prepaid their Medicare, and this is something that is a reach too far for our seniors, and they do find it distasteful.
All right, Congresswoman, thanks for being on. We'll continue this when you come to New York. Let us know.
Joe.
Would love to get you on the set. Thanks.
Absolutely. Thank you.
All right, thanks.